Men post-prostatectomy get two massive complications that they know very little about. They get urinary incontinence, so they have to wear pads. So what those men should be doing on removal of that catheter at about day 7 to 10, in the ideal world before the surgery, is they should be doing anterior or front focused pelvic floor contractions. So they should be doing fast contractions. That's the nuts to guts. They should be doing fast nuts to guts, slow nuts to guts. But they've got to do those in standing, because they're not leaking in lying, they're not leaking in sitting, they're leaking when they move, when they go from sit to stand. So you get them doing them in standing, front contractions, fast contractions, slow contractions, 10 of each. You build that up to twice, 3 times a day. And then once they can do those, you then get them to do them with squatting, lunging, bit of resistance. A bit like we would do with other exercises. We would make it more difficult. The second thing they should be doing is there will be certain activities they do where they will leak. And it tends to be in the first few weeks, sit to stand, or bending down to do shoes. You get them to do a thing called the Knack. The Knack is where they do a strong front contraction, get up, keep contracted, let it go. Or it may be that they're leaking on sitting. So you get them strong front contraction, down. Now, they're not going to do that every time they sit stand, but you get them to do it a lot of the time, because then what happens is that sphincter that external sphincter works a bit more automatically.
How long before they get to see some results from this generally?
Generally, even within 2 to 4 weeks of doing it, they start to notice that they're leaking less, they're getting drier.
Okay.
The second thing that they are not prepared for is complete erectile dysfunction. Most UK surgery is nerve sparing, so those cavernosal nerves are spared. However, they still undergo massive trauma, so they'll still get complete erectile dysfunction, but their potential for recovery is better. Okay. So those men, once their continence is improved, that's generally 8 to 12 weeks post-surgery, should be using a medical grade vacuum pump. And that vacuum pump is a SOMAerect pump from iMedicare, and they get that on prescription from the NHS. Okay. Those men will know nothing about a vacuum pump, and how you get them to use it is you say, if you want to get this erectile function back, you need to use the vacuum pump, because it replaces the nocturnal erection and all the other erections. And then the other thing those men need to be doing post-surgery as soon as possible is they have to be on low-dose daily Cialis or Tadalafil 5 milligrams. So 3 things they need.
Indefinitely, or for a relatively
probably they could be on it for 12, 18 months.
Okay.
So those men, it's front-focused pelvic floor contractions in standing. People will tell them to contract the back passage. It's a waste of time. It's different muscles. The Knack is good, and then low-dose Cialis. Then as they're getting drier, 8 to 12 weeks, prescription vacuum pump. And the other thing I get all those men to do, find their local prostate cancer support group and go to it. Because those men focuses on the surgery. Post-surgery, they're really lost because they don't really understand why they're wet, wearing pads, no erectile function.
And for anybody, it's an embarrassing thing to admit to anyone.
Massively. Men aren't used to wearing pads. Not pads. Men aren't used to wearing pads. Men aren't used to wearing a pad to bed.
And it is a major blow to one's self-esteem not to be able to get an erection, but you still don't want to talk about it.
And if you're leaking, you're not going to go out to dinner. You're not going to go to the pub. You can't train, so socially, you can't talk to anyone about it unless you have a friend who's had prostate cancer and has had a prostatectomy.
Okay.